Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thanks for joining me here at GYN Corner. It's a lovely day here in New York. It's Wednesday, September 5th. Yep, that's right, September 5th. And fall slowly trying to creep in, but we're holding on with our fingertips to the last bit of summer. So I hope everyone else is having a lovely morning also today. Let's see, this is the Facebook live stream, but please check out our YouTube channel. It's also called GYN Corner, and it's very nice. Everything is very nicely delineated. You can just pick and choose which items you want to listen to, which topics are of interest. Please like, subscribe, and follow. You'll get a heads up on the presentations when they're coming and what the topics are. And please give me ideas for things you'd like to hear about or information you'd like to know. If you have a commute or if you have a job or you're driving a lot, please check out the podcast. It's also called GYN Corner, and we're on 8 different platforms, the most popular being Google Podcast, Apple, iTunes, Anchor, and Spotify. So let's see, today I'm talking about garlic and the vagina. Now previously I spoke about apple cider vinegar, tea tree oil in the vagina. Today it's garlic, so we're kind of going through the kitchen shelves and through the bathroom shelves and finding out what things help. These are really topics of interest that a lot of patients come in over the years and ask about if they're good, or they ask what alternatives are there rather than coming into the office and getting an exam and a prescription, blah blah. So garlic has been used for centuries as an antibacterial, antifungal, varicidal, and it's also anti-yeast. So even today a lot of veterinarians use garlic as healing methods for cuts, scrapes for animals. Garlic has been used for years, not just to ward away Dracula and vampires and Nosferatus, but it's been used for years for preventing the common cold. Ingesting garlic on a daily basis, especially in the fall and winter, does help boost the immune system and helps fight away viruses. It's also been proven in research laboratory studies that garlic is anti-varicidal, so it kills a lot of common viruses. It's antibacterial for a lot of skin and intestinal bacteria, that it does also fight moles, and it's antifungal for yeast imbalances and athlete's foot types of fungi. So yeah, some people use garlic, crushed garlic, as a treatment for athlete's foot. It's also been used steeped and crushed and put in spray bottles as an insecticide for gardens. It's been used, I already mentioned the veterinarians using it for animals as an antibiotic, and it's been used to kill household insects and spiders. Let's see, some people have also used it for ear infections. Years ago, before antibiotics, people just used household garden farmland substances. So they have used it steeped, boiled, I should say, cut up, and then soaked in olive oil or mineral oil, and then using the oil to drip in ears for ear infections. It's been used for cold sores, for fever blisters, and mosquito repellents to rub on the skin. And it's also been used for acne. Some women will wash their face with garlic juice in it, crushed garlic that's been steeped. They feel it helps to exfoliate and tighten their skin, and it's been used directly on acne as an antibacterial to decrease acne, because a lot of acne is due to skin bacteria. So even the dermatologists, their treatments, a lot of the treatments are antibiotics. So if you use garlic, that also helps as a home remedy or an over-the-counter antibacterial. So it has also been used vaginally to treat bacterial infections, yeast infections, and skin irritants, like jock itch type of irritants, or what we call a contact vulvitis or contact dermatitis. It has been controversial, of course, over the last 10 years or so. There have been a lot of, air quotes, experts saying that garlic is useless, that it doesn't do anything. These are all placebo effects, but you can't really say that over 1,000 years worth of experience is a placebo effect or an old wives' tale. I've told patients for about 25 years now that they can use garlic on a repetitive basis to help prevent bacterial infections. I don't recommend it as much for yeast infections, although a lot of the literature does support for yeast infections, but I've recommended it for 25 years for preventing and treating bacterial infections, and I've had tons of patients who have gotten really great responses from the garlic because it is proven to fight bacteria, yeast, fungal, and molds, and some viruses like the cold sore herpes virus. So what I tell patients is it's better as a preventative measure. So if you've had several or frequent outbreaks of bacterial infections or yeast infections, the garlic will work better if you use it on a habitual basis for a chunk of time. So I always recommend taking a garlic clove. So you take the bulb, you peel the clove, and then you place, get a thread, needle and thread. You place a needle through the center of the garlic clove and make it long, so it's about the length of a ruler, about 12 inches long. That way you can push the clove all the way up in the vagina. You'll have the string hanging out so that it's easy to remove. Some people just fish around with their fingers for it. That's a little bit difficult for a lot of people. So if you thread the garlic clove, shell all of the peelings off, thread the clove with a needle and thread through the belly. I recommend threading it 2 or 3 times so it's a fairly thick, firm grasp, and then cut the ends off because it's thought that the garlic is less helpful, less potent if it does not have an exposed end, a cut end, or if it's not crushed. Apparently that releases a very active ingredient in the garlic. It's called anicillin. So if you cut the ends off, the little tippy ends, you cut both ends off so that the garlic clove is blunt. You have the thread it through the belly or through the center of the clove. Place that in the vagina before you go to bed as deep as possible. The further up it is, you should not feel it. You'll just have the string that you've made in order to remove it hanging out, and then you remove it in the morning. Now, people do report that once they place the garlic, they do start to taste a little bit of a garlic taste, but if you do it right before you go to sleep, you're not going to notice because you're sleeping. So there is a little bit of a garlic taste with it. Then you just remove it in the morning. I recommend, if you've had a frequent series of vaginal infections, I recommend placing the garlic before you go to bed every night for 1 week. The second week, 3 times a night. The third week, twice a night, or 3 times a night, that's silly. 3 times a week. The third week, twice during that week, and then stop. See how you feel the 4th week, and then if you feel normal, you could just periodically do the garlic 2 or 3 times a night. I don't know why I keep saying night. 2 or 3 times a week, like once a month or every 6 to 8 weeks. That will help maintain that antibacterial environment, not so much that you start to kill the normal flora, the normal bacteria that's supposed to be there, but that you kind of shave off and decrease any excess bacteria that's there. If you have an infection, then you'll want to do the garlic, but you'll have to do something in addition to the garlic. So some people will take garlic supplements, or they'll add a lot of garlic to their food. That will help also. Or what I recommend people do is they do the garlic at night if they have an infection, and then during the day, you can refer to a previous presentation, do the apple cider vinegar or a tea tree tampon insert. So during the day you do one of those two because they don't have issues with your mouth tasting kind of bad, and then at night do the garlic. So if you do day and then night, when you first notice an infection, you first notice a discharge or you first notice an odor, do that straight away for a week. Now obviously if you have an infection, you do that for a week, it doesn't work, then you should come in because maybe it's not just a simple yeast or a simple bacterial infection, maybe there's something more sinister or complex going on. So I hope that's been helpful information on garlic and the vagina. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, Midtown Manhattan. We're a couple blocks west of the Empire State Building and just around the corner from Penn Station. If you're in the tri-state area, please come on by. I'd love to see you. And please like, comment, subscribe, get a heads up on the presentations, and check out our YouTube channel. It's also called GYN Corner. Have a great rest of your hump day, and take care. Thank you.